I want to now ask Dr. Amy Edwards to join us. We're Skyping in Dr. Amy Edwards, who is a pediatric infectious disease doctor and Associate Medical Director for Infection Control at University Hospitals Rainbow Babies and Children's Hospital in Cleveland. Dr. Edwards typically focuses on prevention of hospital-acquired infection and transplant infection diseases, but during the pandemic she's been caring for children who test positive for COVID-19. She's also headed up the task force that established diagnostic and treatment guidelines for multisystem inflammatory syndrome in children as related to COVID-19. During the past couple of weeks, Dr. Edwards noticed a disturbing trend at Rainbow Babies throughout the pandemic. As we have talked about, very small number of children have been very sick. Typically only 1% to 2% of children there were testing positive for coronavirus. Doctor has started to see some changes in that. But Doctor, I wonder if you could first maybe start in talking about the overall situation with children. We have been proceeding on the assumption, and the data has shown that children generally do not get very sick if they do in fact get the coronavirus. And so I wonder if you could just talk a little bit about that, and also what you have seen and what some of the new things are that you're observing, new problems you're observing with some children. Thanks for joining us.
Oh, thanks for having me, Governor DeWine. So for coronavirus in general in children, you're absolutely right. The vast majority of children are going to do great. They're either going to have asymptomatic or what we call paucisymptomatic disease, which is, very minimal symptoms, which is typical for kids with respiratory viruses. And certainly, even with some of this new data coming in, children are nowhere near as affected as the older age groups, which, of course, I'm eternally grateful for. But in recent weeks, or maybe for the last month or two, what we've been seeing is an increase in the number of kids who are testing positive for coronavirus. Initially, some of that certainly could be laid down to increased testing as we were working together with the state and other institutions to increase our testing. Of course, we captured more kids because we were testing more kids. But what we've really been seeing recently is an increase in the percent of tests that are coming back positive, particularly in symptomatic children, meaning that for kids who have symptoms of a respiratory viral disease, a larger percent of them are coronavirus than earlier in the pandemic. And, it's to be expected as the state opens that we're going to start to see more positive kids, but that rate has been going up. It's something we're keeping our eye on. It hasn't gone up dramatically, about 5–6% or so, but it has been a steady increase, and it has not stopped increasing as of yet. We get, we gather data every day, basically. And together with that, we have seen a slight uptick in hospital admissions for COVID-19 in children.
Well, Doctor, as a parent and now grandparent, but not directing it necessarily to me, but to anybody who's watching today, if I'm a parent and I have little kids, what do I look for? And that's always it seems to me is always the question as a parent. What should I look for? What am I to be on the alert for? And then how do I react if I see it?
Well, with kids, the symptoms actually aren't that dissimilar from adults. It's a respiratory virus, so you're looking for respiratory symptoms: cough, runny nose, shortness of breath, of course, fever, that sort of thing. Kids get this all the time, right? Any parent or grandparent can tell you that kids are always running around with a little bit of a stuffy nose. So if it's mild, if it's something that you feel like you can manage at home with your pediatrician, you may not do anything differently at all. But obviously, if your child seems to be having a little bit more trouble breathing than they normally do, if they're having trouble with their appetite, they're not eating and drinking as much as they should, then you might want to talk to your pediatrician about it. As you mentioned before, anybody that wants to be tested can be tested. Certainly, that's our policy here at Rainbow. We've liberalized our testing such that any child with symptoms can now be tested, not just the ones who are admitted to the hospital. And so if you're worried at all, just let your pediatrician know, and we can certainly get your child tested.
Okay, great. Anything else that you think we should know? Anything else you'd like to tell our viewers out there and listeners?
Yeah, the only other thing I'd like to say is, as we've been seeing the increase in coronavirus, so too we've been seeing, more cases of this inflammatory syndrome that you mentioned, the multi-system inflammatory syndrome in children. And so I do want to remind parents to keep an eye out for that. The symptoms of that are, high fever and GI symptoms like nausea, vomiting, diarrhea, stomach pains, rash, red eyes, that sort of stuff. We have information about that on our website, at the Rainbow Babies and Children's website, including a frequently asked questions section for parents. But I do want parents to keep an eye out for that too, not just for COVID.
Okay, and what about a child that has asthma? Anything in particular to watch for, or just be more alert about, or?
So we've had some kids come in with asthma exacerbation secondary to COVID, and that actually seems to be the part that's pretty standard. The kids come in with their usual asthma exacerbations, and they respond to albuterol much as they always do. So at least here at Rainbow, we haven't seen anything different with our asthmatics. It's just another respiratory virus that can trigger their asthma.
Dr. Edwards, thank you very, very much. We'll let you get back to helping kids, but thank you. We appreciate it.
You're welcome.
Thank you very much.